If your nursing program uses ATI, you won't want to miss this video. We'll dive into how to pass your ATI nursing school exams and use them to your advantage while studying in nursing school. Let's dive in. Now, hands down, the most crucial rule you need to follow when studying for ATI is to start studying early. Not giving yourself enough time to study and having to cram for those exams are the top reason that I see students not do as well as they hoped to. They didn't give themselves enough time to prepare, to study, and to learn the information. Please don't cram the night before or the day before your exam. You need to give yourself time to absorb and actually learn the information, not just memorize it for a short time. ATI exams are looking to see that you are able to critically think, put the puzzle pieces together, and connect the information. And memorizing last minute will not help you do this. You need to have time to absorb the information so you can retain it and apply it to the question. For more of my top study tips, don't miss this free study checklist that I have for you. It will give you a breakdown of the best study strategies to use in nursing school to help you pass. Now I'll put a link to that in the description below for you to snag it. All right, so you promised me that you'll start studying early and keep studying consistently, right? But now you're probably thinking, how do I even know what to study for these ATI exams? And that is a valid question, my friend, because these exams are comprehensive and they cover so much. So step number one is this. Don't freak out. The good news is that if you are studying the content ahead of time, really breaking it down and learning the concept step by step, you will be able to critically think through those questions. You'll connect what you know, and you'll be able to apply it to the question being asked. When it comes to studying for ATI, if you have access to the online ATI resources and modules, use them, please, and go through that a little bit every day. There is a lot of material there, so you don't want to wait until the day before your exam to go through it. Go through the modules, take notes on the things you don't understand, and then pull up those topics in your book and learn more about it there. So, along with reading the sections of the book that your instructors, your professors covered in class, you will also want to read the parts from your online modules that you don't understand. You've heard me say time and time again on this channel, the goal is not to read the entire book just for the sake of reading it. The key to passing nursing school is to focus your study time on the things that matter. So focus on studying the things that your instructor talked about in class and the things that are covered in your ATI modules and slides. The next thing you will want to do is to make sure that you are fully prepared for your ATI exam is to take all the practice tests. My friend, I cannot even tell you how many students have told me the same thing. They thought the ATI practice tests were just busy work, but when they did them, it ended up making a huge difference in their grade. The practice tests are a really great indicator of what your ATI exam will cover and a really great way to get in the critical thinking mindset. So ATI exams are test banks. So they're essentially trying to simulate the NCLEX and make sure that you are capable of being a safe and competent nurse who can critically think and problem solve through caring for a patient, right? Now, the best part is that since these are test bank exams, they have a big variety of questions and a good probability that some of the practice questions will repeat and show up on your actual exam. And even if it isn't word for word the same question, the concept that they're trying to get across and test you on will be the same. So the more practice questions you do and the more rationales you review, the more likely you are going to be familiar with the actual exam question. If you have time and can schedule these in ahead of time, I recommend spacing them apart so you can have time to go back and look at why you got the questions wrong and really take the time to fully understand the critical thinking in the question. You want to space out the practice test so you'll be able to take one, go through it and look at the rationales, and then take the next one. The goal is to increase your grade each time you take the practice test. And a huge key in doing that is by going back through the rationales and understanding why you got questions wrong in the first place. Now, if you needed another reason why you should be doing the practice questions for these ATI exams, don't worry, I have one more for you. Just as you would practice soccer in order to fine-tune your skills and be more confident as a soccer player, the same concept applies when it comes to answering NCLEX-style questions. The more practice you get at answering those ATI practice questions or NCLEX-style questions and learning why the correct answer is what it is, you will be much more prepared for when you go take your proctored ATI exam and the NCLEX. These test bank exams are designed to prepare you to take the NCLEX exam. So one of the major benefits of taking all of these practice exams is that you are really training your brain how to answer these questions, sorting through the keywords, the concepts they're testing you on, the wording, and the overall layout of the exam questions. So the more practice that you get with these NCLEX style questions, the better off you're going to be when it comes time for you to take your ATI proctored exam and the NCLEX. Now, learning how to study and take the ATI exam is one thing. Now, it's a whole other thing to actually learn how to answer ATI and NCLEX questions, right? So click on this video here where I'm going to give you the best strategies to pick the most correct answer on your exams. And as always, my friend, go become the nurse that God created only you to be. And I will see you over there in that next video.